everyone, this is Stephanie with Healthcare-Edu. I'm going over the CNA skills for 2021. We are in the state of Massachusetts, so Prometrics just took over and is doing our testing. So we are going to shoot videos. I'm actually in the school now. So this skill that we're going to do is a partial bed bath with a mannequin as listed on the Prometrics checklist. Now, prior to doing any skill, we wash our hands. So I have done that and I've put my gloves on. You can go back and watch my hand washing video. That's a tongue twister, okay? And because we're actually in the class and my wonderful students are helping me, we have privacy curtains that will mimic pulling, okay? So let us go over the supplies. If your evaluator does not have gloves and hand sanitizer in the room, I would suggest bringing it with you. So I teach my students that because you're gonna have to hand sanitize several times. So we have paper towel, we have lotion, we have soap, we have a water thermometer, we have the wash basin, okay? For this skill, I bring in 5 washcloths and you'll see why, okay? I have a bath blanket, all right? I have a top sheet that will be on afterwards. So I kind of try to put it in the order that I will use it. And then you have 4 bath towels. What I did, because the towel you use under the face, and you'll see, it could be 3 bath towels, and I use a hand towel because for the face, you don't need that big a towel. If they don't have a hand towel, just bring in 4 bath towels, okay? So I have gathered my supplies. So I'm gonna go in here with my supplies and I kind of put them in a certain order here, okay? It's a little tough here to carry everything. And so when you go in with everything, so now I'm going to knock, okay? Knock, knock. And my mannequin obviously cannot speak with me. I'm going to pull the privacy curtains. We could take a look. This is the privacy curtain I will pull. The reason I'm not pulling it because we have class on the other side. So I've knocked, I've pulled the privacy curtain to make sure that I ensure for privacy. I'm going to come in and introduce myself. My name is Stephanie. I'm your nursing assistant. I'm going to give you a partial bath today and a back massage. So what I do first, before I have to check the 2 patient identifiers. Can I see your 2 patient identifiers? I have, when it's a real life patient, show me without touching the patient, but I'll check again when I change gloves. So I do everything related to objects before I touch the patient. So in this first step here, I need to create my clean surface. I've created my clean surface. Some of my towels are opening up, but I have to make sure all the surfaces are covered. Okay, so now I'm going to lay my stuff down. So I have my gloves, I have my hand sanitizer, my lotion, my water thermometer, my soap. Okay, so what I'm going to do, I'm going to go fill this with water. I will be right back. To exit the room, I'm going to take my gloves off, hand sanitize. I'm gonna exit the room, open the privacy curtain. I'm gonna come out, fill my basin with water. The evaluator will tell you if they really want to fill it with water. Fill it with water. Hand sanitize. I'm going to go back in. Knock, knock. I'm back with the water. Pull my privacy curtain shut. and lay my water down. I'm gonna put my gloves back on. So we hand sanitize a couple of times in this skill. So a couple of things we're gonna do before we even engage with the patient, okay? I'm talking to you, that's the only reason in real life my back wouldn't be to the patient like this. I'm gonna check my water temperature. This is a glass thermometer. The temperature is within the range 110 to 115, so it's appropriate. I'm gonna ask the patient to just check and make sure that the temperature is good for them. It's appropriate, okay? So now I'm going to prep the patient. I have not dropped my side rails yet. My bed is going up for proper body mechanics. We're just raising the bed, okay? I'm bringing up the bed up higher so that I can give you a partial bath. Okay, that's as high as my bed goes. And so now, still before I'm with the patient, I'm going to open up my bath blanket. And again, you're never shaking. You open and you unfold. You ask the patient to hold the bath blanket or you tuck it under their arms. So I'm gonna tuck it under. And so now I'm going to roll the sheet out from under my patient, making sure not to expose them. And how you roll a sheet, you roll it, you never have it touching your scrubs. You roll it away from you like so, and it's going to go right into the hamper. So now my patient has the bath blanket on. I'm also going to roll and get the Johnny off. They might have your mannequin already naked. If not, you have to take the Johnny off and just make sure that they are not exposed. Okay? So once I start doing that, if you need, you're not supposed to reach over the side rail. So as you're trying to get to the other side, you can put the side rail down. So I'm gonna put some of my stuff here as I go. Now, once I drop the side rail, I have to make sure I don't go anywhere. So I'm just gonna finish taking off this bath blanket, making sure not to expose you. Again, rolling away from you, right into the hamper. I have not stepped away. Now here again, I could do the double check on the name band, okay? Okay, so what we can do now, everything was clean. We are going to do the eyes first. So you could actually hand hygiene again. I'll hand hygiene. Don't step far. This is why I bring everything here with me. And you can mimic hand hygiene if they don't have it and just say hand hygiene. Say that you would hand hygiene and put gloves on. But I like before doing the bathing part again that I have hand hygiened. So I'm going to lay my hand towel over like this. I'm going to do my eyes first. I'm just gonna sit you up a little bit, okay? I'm gonna put your head of bed up a little. Ooh. Just slightly. I never step away from the bed. I'm going to make my mitt. I'm sure your program showed you how to make a mitt, wrap it around. We'll do a video where it's close up so you could see it. And so it's a little bit of a messy mitt. Let me redo that there. I'm going to make my mitt, okay? I've made my mitt. For the eyes, we are not using any soap. So I rinse it, make sure it's different corners. So now I'm on this corner here, and I'm gonna start from the inner to outer, okay? And then the other corner, inner to outer. So if somebody has conjunctivitis or anything, that you do not get that mixed up. So I'm going to put it in the hamper. Okay, so now I'm going to, your hamper probably will be a step hamper. Now I'm going to do the face. I'm gonna have, ask if they prefer to use soap. Do you prefer to use soap on your face? The client says yes, so I'm gonna have a soapy mitt and a rinse cloth. So I'm wet this, put some soap, it might be liquid soap, and I'm gonna do long firm strokes going down. So it's soap, soap, it's the face and the ears and the neck I'm doing in one motion here. So soap, always make sure the evaluator knows which one is soap and rinse. So clearly say that. Soap, rinse, face, ears, necks, long firm strokes. Notice I'm not doing a circular motion. So my soap is here, my rinse is here. Pat dry. Lotion, I'm just gonna put some lotion on your face, okay dear? Lotion, all right. So now I'm done with my eyes, face, ears, neck, okay? So this towel I can put in the hamper. Now I'm going to do my arm. So I'm gonna make a towel vertically. I'm going to raise it. So it's gonna be vertical. Just should your towel fall on the floor, you can make sure that you just put in the hamper and go back out. So my patient's body is covered. I only exposed the part I'm going to clean. And so this was my soap mitt. I'm gonna do soap. Put some soap, long firm strokes from the shoulder down. When I lift up, I support the joints, okay? Soap, long firm strokes, soap, rinse. So just speak out loud, just like I'm doing, so the evaluator knows that you're doing soap, rinse, and you know everything. I'm gonna support the joint, long firm strokes. So I did soap, rinse, so shoulder about down to wrist, okay? Pat dry, okay? Lotion. I put lotion on. Now I'm going to do the underarm. The underarm is soap. Let me put soap on. And so the underarm, it's a C motion, okay? You could support and do a C to get the patient's underarm, soap. Rinse. In a C motion, underarm. Pat dry. And I could put some deodorant, okay? So now the basin comes right over to the bed. Make sure the basin's still on the towel. My mannequin here. Turn the basin here. I'm gonna clean, soap, wash the hands and the fingers. There's a separate nail care, so we're not doing all of that. They're in the basin, they rinse, okay? Just make sure the basin's on the towel, not on the bed. I take the hand out, put my basin back on there. I'm gonna dry the hands, pat dry, and I'm gonna lotion. Okay, so now we are going to do the chest and the abdomen. So I could roll this out, roll away from me, and I need to put a towel on crosswise. So for the chest and abdomen, It's 2 body locations, don't confuse it as one. So I'm going to open the towel horizontally, crosswise, and I'm gonna slide the bath blanket down, making sure not to expose the patient, and it's not perineum, okay? So for the chest, soap, and this is circular motion here. You're making sure you're not exposing, you're getting under the breast if it's a woman. Soap, rinse, rinse, okay? Pat dry. You want to pat dry under the breast so they don't grow yeast or anything under there. Lotion, or get a funky kind of rash. So that's chest. Don't forget abdomen. Some people forget the abdomen. My towel's large enough so it's covered, they're not exposing. If your towel wasn't large enough, you would just slide it down to go over the abdomen. This is soap. All right, how are you doing, Tony? Tony's my mannequin. I make sure that I talk to Tony as I'm doing the procedure. Abdomen soap, clean the abdomen. Rinse. Okay, pat dry and lotion. I will put lotion on the abdomen. So now we have to, it's a partial bath, so we're not doing lower extremity. I'm gonna make sure I cover Tony. Tony's covered, and I'm gonna roll the towel out right into the hamper so you have all these things near you. Tony, I'm gonna go change the water. So what I'm gonna do, I'm gonna take my gloves off. Hand hygiene. I can put my side rails up. Definitely will put my side rails up. I'm gonna lower the bed, Tony. I'm gonna be right back, okay? I have to go change the water here. So you never leave with the side rail up. You can't leave the room with the side rail up. So I lowered the bed's locked. And I actually, oops, I forgot, these 2 washcloths go in the hamper as well. That's okay, you would just hand hygiene again. So that's why you bring that in the room. I'll be right back. I'm gonna open the curtain. I'm gonna go fill with water. Gonna hand hygiene, go back into the room. Knock, knock, Tony, I'm back with some clean water. I'm gonna pull the curtain closed for privacy. Don't forget to do that. Now I have to check the temperature of my water again. 110 to 115, the water is in a good range. Tony, can you check to just make sure it's good? Okay, Tony checks. All right, so my water is ready to use. So what I have to do is I'm going to, again, raise that bed back up for good body mechanics. Tony, I'm gonna turn you onto your side. So the bed is back up for good body mechanics. I have to put my gloves back on. So it's a lot of hand hygiene and gloves in this skill, so take your time. Don't rush. Okay, I'm gonna drop the side rail, lower the side rail, okay? I'm gonna bend Tony's knee, and if you, I have other videos showing you how to bend. Tony's gonna reach as much as Tony can for the side rail. So I have one hand on the knee, one hand on the shoulder, and Tony's going to roll, okay? Because a real patient would be more comfortable. So they don't have to be naked. You leave the bath blanket to cover as much. I have a towel here. The towel is gonna be on the bed to protect the bed. So I have, remember I said bring 5 washcloths in. It's new water, so I have to use new washcloths. Okay? Soap. So it's long, firm strokes down, up, under the neck, back of the neck, all the way down to the bottom of the buttocks, okay? Long, firm strokes, top to bottom. That's soap. Put my soap towel here. Rinse. Oops. Make a good mitt here. As long as you don't break the principles. Rinse. Top to bottom. Pat dry. Okay, I've pat dry. Lotion. Warm the lotion up with your hands, top to bottom, and here I'm going to give a massage, okay? I'm gonna give Tony a nice massage, a back massage after I rinse, okay? After I put lotion. So soap, rinse, pat, dry, lotion, okay? So now I'm going to remove this towel. Okay, I'm gonna roll Tony back. Tony, you're gonna come back on your back, okay? Tony's back, oops, make sure Tony's not exposed. Tony's back in the appropriate position. So a couple of things we need to do. We need to remove the bath blanket and we need a Johnny for Tony. My students are out there. Can someone bring me a Johnny? We'll add that to the list. I thought I brought a Johnny, but apparently not. So from the beginning, can someone get me a Johnny off of the cart? So this is a video we're doing for teaching purposes. So go back in the beginning, you will add a Johnny to the list of things you're gonna bring because you have to leave the patient with a clean Johnny on. Okay? I won't leave the bed. I've put my top sheet. I'm gonna tuck the top sheet under Tony's shoulder so that it doesn't move. And I'm going to roll out. I'm gonna get my Johnny from my students. So you guys in YouTube land watching this video, when you come in, add a Johnny to the list of things that we were bringing in. So I've removed the top sheet. If I could have the Johnny. In real life, the Johnny would have been there with my supplies. While the patient's covered, I'm going to put the Johnny on. So I'm gonna slide the arm. Now, if you were doing the test and you actually forgot something, that doesn't mean you failed. You would have to put the side rail up, lower the bed, hand hygiene, go get it, hand hygiene, come back up and come back into the room and resume, okay? But you can't see them. I have my students behind there. So that's how you would do it in real life. So get the Johnny on, just ensure that they are not exposed. Okay, so the Johnny's on. Underneath, I'm making sure the Johnny, and when I make the patient comfortable, I can fix it. You don't want to stretch too much because you don't want to have pressure on your back. We'll fold this up real nice. So the Johnny, and then behind the patient's head, you could tie the Johnny there, okay? So what I always do is I take care of the patient before I take care of things on the bedside table. So what I would do here, I would hand hygiene. I would put up the side rail. All right, Tony. I would lower the bed. My side rail's up. Tony has a clean sheet on. Fix it, make sure it's nice. I hand hygiene. I would put the side rail up. I'm gonna make sure the bed is locked, which it is. I'm lowering the bed. Tony, here is your call light to call us if you need us. So the patient has call light in place, bed low locked, clean clothes on. Do you want your head of bed up, Tony? All right, so Tony, I'm gonna put Tony in a comfortable position. And you probably will have to leave and come back into the room several times, okay? You will put this in the hamper, all right? And I will actually leave, bring my basin out, bring my soap, thermometer, and lotion. I will be back to take care of your bedside table, okay, Tony? But again, I take care of the patient before I take care of the bedside table. I'm gonna open the curtain, okay? I'm gonna come out to the bathroom, dump the water, wipe the basin down, put all of my supplies away. Hand hygiene, I do have to go back in one more time. Some people put things other places, or if the room has a bathroom, you could take care of it. But if you have to go back in again, it's not a problem. You're not touching Tony. I'm gonna go back in. I'm just gonna wipe down your table, Tony. Make sure that it's totally clean. The room has Lysol wipes. I'm gonna wipe down the table. I'm gonna give you your side table. I'm gonna leave your room in a neat and orderly fashion. Okay? All right, Tony, you have your call bell. Call us if you need us. Hand hygiene and exit. All right? That's it.